Hello everyone, my name is Bree, and first off I would like to thank everyone for being here today, for Dr. Yorks being my advisor through my last 4 years here at Caz, and to Dr. Flynn, who is my second reader and who I've also had in many classes. So for my capstone research, I chose to research animal-assisted therapy in the classroom, as well as other therapies for children and adolescents with ADHD. So my thesis is therapy treatment will help children and adolescents with ADHD relieve stress, gain motivation, and enhance learning and activities. Some things I'm going to cover today are ADHD and its effects at home and at school, causes of ADHD, non-therapy treatments for ADHD, and therapy treatments for ADHD, otherwise known as cognitive behavioral therapy, equine-assisted therapy, and animal-assisted therapy in the classroom. So the first thing I'm going to touch on is ADHD and its effects on children. 6.1 children across the U.S. are diagnosed with ADHD according to data and statistics. Children who have this disorder have difficulty getting along with others, difficulty paying attention not only in class but at home and other public places as well, and have little patience. They also have trouble with other things such as concentration, behavior, and motivation, and all these things interfere with their everyday lives. So ADHD at home, signs and symptoms usually start at home, and parents, usually start to see things like running through the house, making excessive noise, being easily irritated, talking back, things like that. And they normally just jump to oh, my child has ADHD. And some of the things I'm going to talk about are why taking your child to the doctor isn't the first thing you should do, or run right to the doctor for medication thinking your child has ADHD. Home is the most common place for a child to act out because that's where they feel more comfortable. They're used to their family and siblings, parents and guardians. And it is important for the parent or guardian to maintain a positive attitude, when a child, has one of their episodes, because when your parent or guardian is calm, it is, easier to connect with them and helps them stay focused and come back to, their normal self. And most of the child's behavior is not intentional. And lastly, at home, strict schedules are important to keep the child on track. ADHD at school is a little bit different. You get friends, and there's more distractions. And according to Miller, almost every classroom in America contains one or more child that has trouble paying attention, impulsivity, or difficulty with concentration. Children with ADHD often lack basic reading, writing, and listening skills, so they're often behind in the classroom, which can also lead to other frustrations and failures. Some of the things like not being able to sit still, constantly making noise and disrupting are some of the things that a child with ADHD does in the classroom, and this can also lead to the other kids being disrupted and getting off track. Teachers should reward good behavior just like a parent should at home to keep these children, it should be the same at home and at school, their disciplines and rewarding their behavior. So some of the causes of ADHD, the biggest researched cause of ADHD is genetics, and how genetics contributes to a child with ADHD. ADHD can be passed down, and many studies throughout my paper proved that. And one of them that stood out to me was the cell adhesion molecule study that I read, and it's otherwise known as the CADM gene. It's it's a popular study that aimed to show that this gene is highly expressed in many areas of the brain, and has shown that ADHD is caused from this gene. And prenatal habits during pregnancy are another thing that is dangerous and causes ADHD. Smoking, drinking alcohol, and substance abuse are all factors that lead to an increased risk, as well as lowering birth rates, which can cause other disorders as well. External toxins and illnesses like lead, being exposed to chemicals, cosmetics, gas fumes, anything in the air can cause potentially ADHD, and exposures like this are not good to be around when you're pregnant. So some non-therapy treatments for ADHD that I focus on, obviously medication is a big thing, and exercise was another really interesting thing that I learned, actually. As you can see in the picture on the right, that with exercise, your brain functions a lot better than without. According to a couple studies that I read, they have shown evidence from their studies that exercise can improve cognitive performance in patients with or without ADHD, but they noticed that children with ADHD in these neurocognitive tests shown, increased activity level, increased concentration, motivation, and things like that. Medication was another big thing that I focused on, because I know that that's what, parents, guardians, teachers, families go to is medication. So the two most common classes of medication throughout many of my sources were stimulant medications like Adderall, and then methylphenidate drugs were another one. And then there's also non-stimulant based drugs like antidepressants that help reduce the symptoms of ADHD in a child. Medications do not cure ADHD, so that's why therapy combined with medication is also another positive thing for a child with ADHD. And medication helps a person feel more relaxed and able to function better. So again, it doesn't cure the symptoms, it just, helps them with their symptoms. Cognitive behavioral therapy, also known as training for the brain, and it has shown great benefits for children with ADHD. This is also more for the adolescents, because it creates less anxiety and helps with positive emotions. So having ADHD in your older ages, you have trouble with, relationships, jobs, even in school, like college. And it helps develop better, better behaviors and approaches to certain thinking. The next therapy I focused on was equine-assisted therapy, and I can relate to this because I have horses myself, and I know that the interaction with horses is extremely, it relieves so much stress, and riding a horse can improve self-esteem, confidence, and independence. Not only does it improve the motor skills, but anybody who gets on a horse has body-to-body contact which transmits temperature and emotion. So, I was always told by my trainer, a horse knows when you're nervous when you get on it. So therapeutic riding can help with physical and emotional rewards. And riding a horse moves the human body similar to how a human moves, which leads to improved flexibility and other benefits as well. And the last thing I focused on was animal-assisted therapy in the classroom, which, as medications have become unclear and a poor treatment for ADHD, this has only been on the rise and has been beneficial in the recent years. It improves emotion, attention, and engagement in activities. And the most common is with canines, although I have seen other studies where, they've brought in like cats or small animals like hamsters and the rolly things. And there's still evidence today growing that the interaction with animals in the classroom helps improve a child's behavior and social skills and can provide physical and mental health to all the students. So all the therapies that I talked about, cognitive behavioral therapy, equine-assisted therapy, and animal-assisted therapy have been recently implemented and help students with ADHD either in the classroom or out of the classroom. Animal-assisted therapy is what I focus mainly on my paper, which is, seen as a light, and who doesn't love animals? So I believe that animal-assisted therapy in the classroom can help students cope with their behavior and enhance their learning. And this is my literature cited. Any questions?